Hi friends, welcome to BioGyan. Hope you guys are doing good. In the today's video, we have a question: is COVID-19 gender biased? According to the Sex, Gender and COVID-19 project of Global Health 50/50, for every 10 females there are 11 cases of men of COVID-19. For every 10 female hospitalizations there are 13 hospitalizations of men. For every 10 female ICU admissions, there are 18 in men, and for every 10 female deaths, there are approximately 14 deaths in men. In case of countries where the number of COVID-19 patients is growing rapidly, for example, India, the number of female patients is twice less than the number of male patients. Many studies have reported an association between the sex of COVID-19 patient and their mortality rate. Males have been found to exhibit higher mortality rate than female COVID-19 patients. What could be the possible factors responsible for this biased outcome of COVID-19 disease? So, we will be looking for the biological factors as well as behavioral factors which might be causing mortality rate of males to be higher than that of females. One of the biological factors is estrogen. MERS and SARS-CoV have been reported to exhibit a male biased response. In a mouse model study of SARS-CoV infection, male mice were more susceptible to infection than female mice. The enhanced susceptibility of male mice to SARS-CoV correlated with a moderate increase in virus titer and extensive alveolar macrophage and neutrophil accumulation in the lungs. Furthermore, although gonadectomy, which is the removal of testes, did not affect disease outcome in male mice, oophorectomy or removal of ovaries or treating female mice with an estrogen receptor antagonist did result in an increased mortality of SARS-CoV infection. Sex-specific disease outcomes following virus infections has been attributed to sex-dependent production of steroid hormones. There have been reports of differences in immune response of men and women. Women are functional mosaics for X-linked genes, and the X chromosome contains a high density of immune-related genes. Therefore, women generally mount stronger innate and adaptive immune responses than men. This results in faster clearance of pathogens and greater vaccine efficacy in females than in males. But this also contributes to increased female susceptibility to inflammatory and autoimmune diseases. Reports indicate that estrogen enhances immune responses and subsequently pathogens clearance occurs faster and vaccines will be more effective. Contrary to estrogen, testosterone plays inhibitory roles in immune process, which is a possible explanation for men's higher susceptibility to infections. Thus, sex hormones alterations may cause some changes in the immune response to pathogen. TMPRSS2 gene transcription depends on the activity of the androgen receptors. Testosterone may lead to male predominance of severe infections through modulating the expression of the gene TMPRSS2. TMPRSS2 gene results in protein transmembrane protease serine 2, which causes hydrolyzation of ACE2 protein and internalization of the virus COVID-19. The role of involvement of ACE2 and SARS-CoV-2 can be understood in greater detail by going through our video Alternative Routes of SARS-CoV-2 Infection, which is the link is given in description below. Apart from differences in the disease outcome, there have been reports of difference in the symptoms between men and women. Evidence suggests that female patients experience some COVID-19 symptoms significantly more than male patients, which include fatigue, anosmia, which is the loss of smell, headache, sore throat, and nasal obstruction. Some symptoms were experienced significantly more by men than women, which included cough and fever.
However, no difference regarding disease duration have been reported between men and women. Let us discuss about the behavioral factors which may be responsible for the differential mortality rates among men and women. Adverse outcomes of COVID-19 seem to be associated with comorbidities including hypertension, cardiovascular disease, and lung disease. These conditions are more prevalent in men and are linked to smoking and drinking alcohol, which are behaviors usually associated with masculine norms. Besides the different effects of COVID-19 on the physical status of men and women, studies have shown that the same goes for mental health of people. Studies of general population indicated that women present more mental disorders symptoms compared to men during the COVID-19 pandemic, including signs of depression, anxiety, post-traumatic stress symptoms, and decreased sleep quality. COVID-19 has affected the mental health of female medical staff more than the men medical staff. These have been attributed to child care, elderly care, and housework, which usually falls on the women. Many organizations and scientists have pointed to the limitations of the studies done so far on COVID-19. Reports so far have pointed to a limitation of sex disaggregated data, which means mentioning the number of male and female patients. Many organizations have urged to include age and sex data in all the studies related to COVID-19. Some have expressed concerns that obscuring sex and gender differences in treatment and vaccine development could harm, as incomplete reporting compromises meta-analysis. Addressing the health needs of men and women equally will help societies recover and resist future human tragedy. Please like and share our videos and subscribe to Biogyan. Stay safe. Thank you.